Dr. Kenty, why should we as Black Canadians have the same concerns that some Black Americans have with vaccine confidence and receiving the vaccine when we've not necessarily had the same experiences and have the same history?
Yeah, so that's a very powerful question, and it's a very relevant question, especially because of the diversity of the Black Canadian population. We have people from all parts of the world, all geographies, religions, languages. I think we have as much languages from Africa as there are in many parts of Africa, hundreds of languages. So we have a very multicultural Black community in Canada, probably the most in the world. But despite that multicultural diversity, second generation Black Canadians begin to sort of have the same health indicators, regardless of where their parents came from, because of the social determinants of health and systemic racism that exists in schools, exists in health, exists in child welfare, exists in the criminal justice system. And if you had time, I'd actually spend a lot of time talking about that. The Tuskegee experiment was in the US. Henrietta Lacks, the decisions that were made about her cells were happened in the US. But the Black population in Canada have always been connected to the US. But it's Black loyalists, enslaved Black people running from America, Black people enslaved running from Canada to America. We have that slavery experience in common. And that slavery experience has given rise to a whole range of stereotypes and stigmas, public stigma, which affects our populations today, similarly, in similar ways. And what's important to note is we experience racial discrimination to similar degrees. And I know people don't think that, but they haven't had data to compare our experiences to African-American experiences before. We know now, in the prisons, we have similar rates of incarceration. When it comes to police shooting of people of color, we have similar rates of police shootings, fatal police shootings. When it comes to the health disparities from COVID, we are similarly impacted, not the same scale, but similarly impacted. Our mortality rate from COVID in Canada is 35 per 100,000 versus a white mortality rate in Canada of 16 per 100,000. In America, it's 100 per 100,000 for Black people and 50 per 100,000 for white people. So big difference in terms of scale, but same twice the rate. Black people in both places are dying at twice the rate of their white peers, and which tells you, and actually the hospitalization is the same issue, 2 or 3 times the rate of hospitalization vis-a-vis their white peers. Most importantly, perhaps, we are disproportionately represented in healthcare, not just as nurses and doctors and family care and physicians in primary healthcare, but as orderlies, as nursing aides, as PSWs. And in Ontario, it's about like 30%, I think, and of that 30% that are Black, it's about 80% immigrant, 30% Black, 26% Black females from Nigeria, especially Jamaica and Haiti as well. And because of that preponderance, the risk are multiplied and amplified for our populations. And we in those professions, despite over average education, 40.5% degrees, university degrees, but because of social determinants, because of systemic racism, we just have to take the work. And we take the work, but we get a lot of health risks coming with the work and end up with these health indicators, which indicate very clearly that we are at greater risk, racialized risk, vis-a-vis our white Canadian peers. And that is a very serious thing that we have to understand and address. I hope I answered the question.
Yeah, thank you.
Yeah, Neb, if I may add, I think from the way you asked the question, you're digging into the mistrust. Is that right?
Mm-hmm.
And what that question reveals is that the mistrust that Black people have is more related to what their daily experience is, rather than maybe purely historical issues. So they are saying that our histories are slightly different. We come from different origins, but our daily experience of racism and being denied equal opportunities, equal access to things is the same. So a Black person with obesity seeking treatment gets a different attitude in terms of how he or she is treated in the healthcare system compared with a white, okay? Housing, access to opportunities. So it is these daily experiences of Black people, wherever they come from, whatever their history, they all have that common experience, whether they live in Canada, US, UK. And that's why there's similarity in the social determinants of health leading to health outcomes, although we live in different places and we have different historical backgrounds. So it is that mistrust that underlies how Black people feel about the system, which they are linking to the COVID experience. And what the task force is trying to say is that, yes, we experience it. Yes, we recognize it. Yes, there are disparities in outcomes. But on this issue of vaccine, for now, let us not widen that disparity by not trusting the vaccine. So hopefully the scientists like Dr. Upton, Trevor Aldridge, Dr. Abdulrahman, all these people that you trust, that you have some level of confidence in, hopefully what we are saying will help you a little bit in coming to a realization that taking the vaccine is a smart way of making sure that outcomes for our community are better than what they are now. So, and we hope that this information will be helpful so that your decision-making is not based on some misinformation or misunderstanding, but is rooted in science and evidence.
Absolutely. Thank you.
Quickly, just a personal note. There's a Black experience. What people come here from different places. They have cultural diversity. They're incredible. They're so different. But you come here and there's a Black experience. And so if you end up in an ICU, I've been in ICUs in the past few years, but I have elderly parents and they've gone through many crises. I don't leave them alone. You understand? I don't leave. A family member always has to be with them. My shift done, my sister has a shift. When her shift done, my cousin has a shift. We don't leave them alone. But under COVID conditions, you are left alone. That just tells you that's a situation to be avoided. If I'm telling you, I ain't leaving my parent alone in the ICU. I work in the healthcare system, I work with the hospital for 20 years. I'm telling you that. You know.
Yeah, that's powerful. That's something to really think about.